don't know where to go.
Absolutely.
And you know, we hear about. I want to talk about Alzheimer's disease just for a moment, and heart disease, and also want to talk about estrogen. There's some problems there also, isn't there?
Well,
what is the problems with those?
Well, some years ago, particularly around 1993-94, medical doctors in general were telling women to take permanent Provera really for the rest of their life.
Wow.
So that it would ward off Alzheimer's, osteoporosis, bowel cancer, and heart disease. Heart disease, by the way, is the #1 killer of women in this country.
Mm-hmm.
And when women were weighing that against the possibility of getting breast cancer, it seemed like a no-brainer. Well, you know, take these four, or take, you know, I mean,
exactly. That's right.
It seemed like a pretty grim choice anyway. So they were taking the permanent Provera. But new studies in the last couple of years puts all this into question.
Absolutely.
And you look at the current studies with Alzheimer's. It's true, estrogen, though, does have receptors all throughout the body, the eyes, the brain, everywhere. So it does have an effect on the body, there's no question. But the question is do we really need to supplement it, and are there other ways? Because here's the problem, and I'm sure you've seen this too. People will take supplements, whether it's an estrogen or supplements, they'll go down to the store, and they eat horribly.
They think the supplements are going to do it for them, right?
Right, it's not, it's a supplement.
Exactly.
Supplement to a good diet. That's what, so let me just say that most of the studies have more shown that that estrogen will improve cognitive ability to someone who already has Alzheimer's. It's not necessarily going to keep you from getting it. That's a big difference. And the cognitive change that they have is very small.
Okay, yes.
And in relation to bowel cancer, that's all been put in question too. You know, there's so many other things I'd rather people do, like say eat prunes and eat a healthy, healthy diet, and definitely get a sigmoidoscopy or colonoscopy around the age of 50.
Sure.
I think that is one of the best things people can do, and they're not, men and women are not getting these tests done.
I know they're not.
And I have 2 patients recently who've had bowel cancer in the mid-50s.
I know, and they're saying if they don't feel anything or whatever, they're not going to go ahead and do any preventive measures.
Right, and you don't feel something until you've got a major break. Just like with osteoporosis, people say, well, I don't feel a problem. Well, you don't feel a problem until you have a broken bone.
Well, that's why I always tell people, exactly, and that's why I always tell people, come into my office for prevention.
That's right.
I like prevention. Don't come in when you're hurting so bad, when it's going to take forever to get you well. Let's come on in when we can really look at it and find out exactly what's going on with you, and then we can go ahead and really help you. You know, I want to talk just for a moment about, summarize some things that we talked about on the show today. We don't have too much time left, Dr. Simpson. And let's find, what can a woman do for this menopause problem? So we're talking about, let's summarize it. Diet. We need to clean up the diet.
Number 1.
Number 1. What's number 2?
Exercise.
They need to exercise.
And the exercise should be a combination of aerobic activity, flexibility, and muscle toning.
Okay, so they need to do, let's say they need to do some, maybe, some jogging possibly.
Or hiking.
Or hiking
Hiking's
possibly.
One of the better ones.
Okay.
Biking is
Biking, okay.
Swimming, if they can't do those
swimming,
things.
Those are all aerobic type of exercises,
That's right.
okay? And stretches.
Stretching is really important. If you want to, if people want to avoid getting a hip replacement, it has absolutely been shown that when you have an imbalance of the musculature in terms of tightness and flexibility, you will end up with having a hip replacement because you're grinding on that joint.
Exactly. So,
and you have to really work on flexibility. And it's not. And a lot of people think, well, I'll just stretch my hamstring. Well, it's not just the back of the legs. It's the front of the legs. It's the inside of the legs.
Exactly.
It's the deep hip flexors.
Exactly.
That really cause a problem. Because in other countries, you see people sitting with their legs crossed.
That's right.
You can barely get Americans to do that after 30.
I know that. I know.
And you see people like 80, 90 years old in India, and they're just able to sit like
really
that. Because we're sitting like this all the time, and there's no flexibility happening here.
Exactly.
Yeah.
Well, that's why I make sure all patients, they do a lot of stretching. They have to.
That's right.
And let's talk about the other thing then, is weight-bearing type of an activity like weightlifting. You know, people think weightlifting, they have to lift 1,000 pounds, just very light, then weightlifting as an example, very light.
It depends.
Okay.
If weightlifting is great, when I usually would have a patient, first of all, work with me for about a month.
Okay.
So that I would help them get their joints functioning properly, etc. And then perhaps get to the weightlifting. But I would also have them work about 6 times with trainer.
Perfect. Well, we got some good things. We're running out of time. I wish we could keep on talking. You've given us some very, very valuable information today. And again, for our viewers out there, if you're interested in finding out more about these particular problems that we've been talking about today, menopause and osteoporosis, feel free to give me a call. My number will appear at the end of this show.